5 on your mental health tonight. $100 million donation made to Boston Children's Hospital. Rob and Karen Hale are behind the gift to help create a new psychiatric facility to help kids. The total bill to build, though, is upwards of $600 million.
Our Jessica Brown spoke with Dr. Erica Lee, a psychologist at Children's.
Well, thank you so much for joining us, Dr. Lee. We always appreciate you having you on.
Thank you so much. It's nice to see you.
Yeah, absolutely. You know, you've been on the front line of the mental health crisis facing kids. How do you think the $100 million will make a difference?
I mean, it's hard to overstate how important this kind of giving and commitment to youth behavioral health is, not only, of course, by the very generous Hale family, but also by Boston Children's Hospital and our Department of Psychiatry and Behavioral Sciences. We are now a long way from the toughest days of the pandemic behavioral health crisis, and we still lack enough infrastructure, right? We need more comprehensive program. We need more staff to give kids the level of care that they need when they need it all in one place. And this gift truly is transformative. It's going to help us provide families with inpatient, day and outpatient levels of care in a state-of-the-art space where mental wellness is the primary focus, while also offering us opportunities to continue to research ways to prevent and treat mental distress, and also, of course, training the next generation of behavioral health clinicians. It's amazing.
Yeah, absolutely. You know, we've talked about boarding a lot in the past, the boarding problem for kids. How would you describe the situation in Massachusetts right now?
Yeah, so the boarding situation is improving, and there's more work to do, right? So the state, partners like Boston Children's Hospital, they've been working so hard to get those numbers down. And across the state, we're still seeing numbers between 25 and 50% at their sort of peak moments of how many children are boarding in an emergency department waiting for a bed in a behavioral health program. And, you know, again, thinking about this new gift, right? It's not just about adding more beds. What we're really hoping to do is to create a truly innovative, comprehensive care model where we're working together with community organizations, pediatricians, schools, faith organizations, child care programs to say, how are we genuinely supporting children and families in their communities before they're getting to this point of crisis and needing to be in an emergency room?
Yeah, for sure. I mean, you know, what are some of the ways that this major donation could help local families?
Yeah, so, you know, one of the things I was thinking a lot when I heard about this amazing news is that one of our department's current priorities is on providing what we're calling whole child and equitable care, meaning that we're prioritizing not just a child's physical well-being, but of course their psychological well-being in their own context and in their own space, and that we're doing so in a way that is genuinely accessible to families regardless of their life circumstances. So many of the youth right here in Boston, so including neighborhoods like Brighton, face significant barriers to behavioral health care. And really what we need to do is we need to be creating a better avenue for families to get the support that they need in an evidence-based, culturally responsive, non-stigmatized way. This new campus is going to open up so many new opportunities to re-envision how we deliver that care and really move towards the promise of that goal. It's really, really exciting for all of us today.
Yeah, Dr. Lee, thank you so much for your insight on this. I mean, it's incredible news, so thank you so much for your time on this.
Thank you so much.
All right.